COVID-19. Less has been done as many parents are decrying of medical supplies in there. A lot of inadequacy. Now we're talking about over 300 families. They are losing their people to nodding syndrome, and it is really biting and really hurting. Now, nodding syndrome is a mysterious illness that affects the brain and the central nervous system of children, primarily between the ages of 5 and 15. It is really bad, and the disease that mentally and physically retards children has led to rejection and many forms of child abuse such as defilement. So what is happening in Padel, it is really demoralizing, as over 300 families in Agago sub-county in Padel are in desperate need of medical supplies for nodding syndrome parents and patients there. Government has done less, because this is not the first time this has been in the news. These people have been decrying, saying, please help us, but less has been done. Now, given the high medical and food demands in the nodding syndrome patient, families have been left in tears as they wish that the patients could just die. I can't imagine. Now this is really bad. So we call upon government to please run to Padel and really help these people out, because what is there is not good. Now President Museveni several times has promised to deliver on health in these places. While President Museveni's 2014 pledge of 208 oxen to families affected by nodding syndrome in the Padel that way back in that year in 2014, this thing seems to be far-fetching, and everyone is wondering what's happening. The district leaders have asked State House to call Controller Miss Jen Bakeke. Then they were asking them and said, please remind the president on these pledges, but also we need to upgrade the Awere Health Center 3 to a health center for its status, in order to expand this capacity to handle the diseases that are troubling these people. People just nod to death. Parents watch their children dying. So something must be done. Whoever is responsible, we call upon Minister of Health. Something must be done in Padel. Yes, Namale.
I think there's a lot that is still questioning in the world when it comes to health services. I was seeing a story in Tororo where people can no longer afford to go to government facilities to get treatment because there is no drug. There are no drugs. There is a drug stock out in government hospitals. So they are forced to go to private hospitals, which are not budget friendly for them. And according to the Tororo RDC, they say it is because National Drug Authority is still moving with the population. It is 10 years past. The population of people in Tororo has now what? Has now grown. Naye eddagala, capacity yeddagala gye batwalanga mu Tororo 10 years ago is the same capacity of drugs that they're still taking there. So I really think that when it comes to the health ministry as a whole, I really hope that the government this year tries to prioritize, in this financial year, tries to prioritize because budget allocations.
Most of the treatment centers are lacking enough funds to run these places. They are small, like you said. The numbers have grown. Ugandans are giving birth. Ugandan population is growing. We're talking about 1.6 people who are born every year. So you can understand what is happening in Kitgum, in those areas, Pade, Eastern Uganda, Northern Uganda. Something must really be done.
Well, still talking about budget allocations, I need you to know that the State House is seeking approximately 6.5 billion Ugandan shillings to procure new vehicles for the president as well as the vice president in 2024-2025 financial year. Yes, sir? Did you have something to say? But I'm still breaking it down for you. If you feel like you're being shaken, first listen as I detail. I don't want you to...
No, Mali, don't complain.
Sit there, and sit there and listen. Sit right there. Don't move. We're digging deeper. So this request was made by Sadat Chisubi. This is the head of planning office of the president of the president's office, while appearing before parliamentary presidential committee to defend the office's 2024-2025 budget framework paper. Now, MPs were also puzzled that the cabinet approves approximately 30,000 cabinet decisions in the course of a financial year, but only 6 decisions are being monitored by this office, and according to them it is because of budget allocations. They don't have enough money. But the office listed a number of activities as to why they will need more money this financial year, and some of them are they will need about 5.5 billion shillings to monitor and evaluate the NRM manifesto. They will also need 4.7 billion to monitor the parish development model. They will also need 7.4 billion to monitor industrialization and research programs. But now MPs were a little bit confused because they were allocating different funds for monitoring and evaluation and monitoring and inspection. I don't know if you're getting different funds for monitoring and evaluation and monitoring and inspection.
So those are different.
So people, MPs were like, but these are the same things, of which we also have different agencies that are monitoring the same activities that you claim that you're monitoring. But the office said, no, these are actually different things and we need different money allocated. But they also will need 32.3 billion to procure vehicles, computers, executive office furniture and curtains for RDC's offices across the country. They will also need approximately 2.8 billion to instill morals in you Ugandans that have persistently failed to have morals. Those are some of the things that are going to be, we are going to be spending your taxes on this financial year. And to be clear, this budget is only from the office of the president. So we, today, I'm not going to go deeper into the other offices, but every day here on the Health Morning, I will be giving you a little breakdown per office on how much money the office is demanding this financial year. So sir, wembanga kali kengambye nti aka 6.5 ke kakutiisize nnyo, it's still going. So
twetaaga ssente tuyigirize empisa.
Temulina mpisa.
Office ya president yeetaaga emmotoka endala.
Ne kateni. Actually motoka ya president ne vice president naye twetaaga ne executive curtains ne furniture ezigenda okubeera mu office z'aba RDCs abali mu nsi yonna.
Sijja kaaba.
Executive curtains killed me though.
Naye tuli mu bintu byonna. Anyway, waliwo otuuka. Noga sijja bikaabayo nga tuyina kyakukola.
Ensi yaffe.
So eddagala tulireke soke tugule entambula, tugule curtain, ate nazo nga prices ziri inflated.
Gwe bagambidde executive kitegeeza nti eyo furniture bagenda gya allocating billions of money.
Anyway, sijanza kugwa maanyi. Namale, we are just hours away to the inauguration, the long-awaited inauguration of the Clock Tower flyover. That place, you know, we know all what happened there, and something's going to happen now. UNRA plans to officially inaugurate the public flyover at Clock Tower. They talked about today, so we're waiting to see now. This comes after something like few days to the non-allied movement summits. Not only that, but also the G77 plus China summits, which are taking center stage here in Kampala, Uganda. But now people have been quarrying and have been actually grappling. There has been a lot of insecurity in that area. I mean, grabbers of phones. I mean, women have been, everything has been happening. They snatch side mirrors on our cars. There's a lot of insecurity in that player. Now, police says that we are going to ensure maximum security. Now, there is a tunnel in that place where there is Arena Mall. There's that tunnel. So when you look at that tunnel, sometimes you're like, Mukama Katonda wange. Kiki ekigenda okubeera wano kakati sako fly over eno waggulu abantu bagenda kuyitayo. So but police yagambye nti bagenda kusaawo security, naye luli abantu badde babanyakulako obusimu n'ensawo ne bazitwala ne bababba nga poliisi bweri. Kakati ku luno simanyi kyanjawulo nnyo naye nga olw'okuba nti enkuŋŋaana zisembedde awo oluguudo olwo bagenda kuluggulawo namale.
Kirungi bagenda duggulawo. It's been years of constructing that road. It's been really a lot of time.
Kubanga luli bagamba nti COVID yali alusibye. Okay, kati katulabe ekigenda okubaawo nga balugguddewo.
Well, of course, bali balina okuluggula engeri gye tugenda okubeera ne NAM conferences zino ezijja in just a couple of days. We're just a couple of days away from.
Zitufukidde ekizibu kubanga enguudo nyingi ze bagenda okusiba. Nawulidde Gaba Road.
Naye balina ogisiba.
Kakati ate abantu bagenda kukola. Tugenda kutuuka tutya ku
mujja kweyiya.
era nabadde noonya kubira mulirwana wange mwami wava munno n'abalala twekulemu awo lukuŋŋaana tugenda kutambula tutya ffe ababeera eyo.
Temulinaako walala musooka yite muyiteko eyo muyite ku mazzi mugule ennyonyi nze simanyi kizibu kyammwe.
Ate
eno conference tulina bapulezidenti bangi
noteeseza kwasinga bakwata kusendeza State House ne batugirako akasente bakolera eryato.
Ati gwe notandise okuyingirira nnyo ebintu by'abantu.
Nteesa buteesa naawe bw'oteeseza.
Toteesanga otyo olina eggwanga liryo.
Kati.
Okay, still about Uganda, Chintu. Of course, we have an issue where mental health experts are now picking concern in the fact that poverty is escalating the number of suicide in the country. So let's try to understand this story. The rampant poverty levels across the country have escalated cases of death by suicide. Now, this is what the health experts have said. Particularly the Executive Director of Mental Health Uganda, Mr. Derek Chiza Mbuga, says on average, about 15 suicide attempts were registered through the organization's hotline in the last quarter of this year, adding that 3 died before they were reached out for counseling, while 12 of them were actually saved. He cited Karamoja, Kapchora and Busoga regions as areas with a lot of poverty levels that have precipitated deaths by suicide cases. According to him, he also says calamities like COVID-19, landslides, cattle rustling and insecurity in areas like northern Uganda have also attributed to this escalation. In his words, he says during the COVID-19 pandemic, people were left indoors, and since then their income has still failed to regain momentum, and for them to get out of poverty has become a solution, has become quite hard, and the solution is to simply take their lives. He also added that chronic illnesses like lack of jobs, I love the fact that he called them chronic illnesses, like lack of jobs, torture, substance abuse, alcoholism, mental illnesses and disagreements in relationships and marital problems as well are also blamed for the high suicide cropping in the country. He further explains that other people die by suicide due to lack of support from those that are around them, and also criminalization of suicide attempts has also increased on these cases. Now, if you want to list into this story a little bit more, you can pick yourself the Daily Monitor paper and go through it. But he talked about countries like Ghana, where he says they have removed the law putting social services, and also this has helped them reduce cases of suicide within their country. Basically what he was trying to say is that the government should not criminalize suicide attempts, because that means that it's going to simply escalate the problem instead of working on them. But of course he talked about issues of a lack of jobs, which he actually referred to them as chronic illnesses. And yes, lack of jobs and torture, substance abuse, alcoholism, mental sicknesses, I think these are some of the chronic illnesses that Ugandans are struggling with, and of course these can push the number of suicide attempts higher within the country. So mental health is still something that Ugandans have not embraced yet.
Those are not the only causes.
And also,
you journalists, you want to put things, those are not the only mental causes. Sente zaffe gye bazibbamu gye bagenda ziteeka mu mmotoka zaabwe ne kateni nga gye temukisazaawo. Ebyo byonna bitutabudde, tuli awo, bizinesi bazigadde, abantu abadde bakola obugundi bwabwe babugadde lwa NAM conference, mental health.
Bwavu.
Kyovulaba bintu bingi bitutabudde. Kyovulaba byavuddeko n'abantu to attempt murder the clergyman. Mental health.
Top stories. Top stories on Healthy Morning.